Good morning, everyone. This is my Dangerous Ideas presentation. So the idea that I chose kind of goes along with my contribution paper. It's pretty much the commonality and tolerance of sleep deprivation in healthcare workers. So the overview of what we're going to be talking about is just kind of like what how things used to be. So nurses and residents on call would be forced to work, 36 hours, and then except in the emergency room where they were limited to 12 hours. But because of certain research that came out, they actually got limited to 12 hours in the emergency department or 24 hours just because of the decrease in function and judgment that healthcare workers experienced past a certain point. Nurses working greater than 12.5 hour shifts increase their risk of suffering occupational injury, making medical errors like switching up paperwork or doing the wrong or giving the wrong medication, and decreases their ability to basically have proper judgment in patient care. The effect of sleep deprivation is after 24 hours of no sleep, it basically is equals the extent of alcohol intoxication. So your psychomotor performance will be equal to drinking a certain amount of alcohol. Being awake for at least 18 hours is equivalent to having an alcohol blood content of 0.05%, which is Utah's legal limit. And often, actually, this 18 hours is pretty common, especially if healthcare workers are held over because either someone doesn't show up for their shift, or you get a call and you have to be held over for a couple of hours. Some clinical implications of this is, especially for first responders like EMTs, paramedics, firefighters who are required to drive. This is very dangerous because you have patients in the back of the ambulance. You've your partner and everything, and you have all of these cars around you. Besides, like, an ambulance is considerably bigger than a normal car, so you have a lot less wiggle room for mistakes. Um, it affects judgment and coordination, like I talked about before, and it can lead to some serious medical mistakes, like giving a patient the wrong medication, giving too much or not enough of like a life-saving medication, or confusing patient information like allergies. I included this comic just because it's a good take on some pretty serious implications of sleep deprivation. It increases the chance of compassion fatigue, which is basically you can only give so much like kindness and patience and understanding to a patient. And if you're sleep deprived, you're less likely to have this kind of patience and compassion in the workplace. Some personal implications. So that includes like falling asleep on the drive home, and that can lead to like car accidents and certain serious implications for yourself and for others. It leaves little time for familial or personal responsibilities. So if you have to like take care of kids, or your spouse wants to spend time with you, it's a lot less likely for that to happen, because if you get off a long shift and you've been held over a week, you just kind of want to veg out and either sleep or not really do anything or use any part of your brain. um, it decreases the quality of life because of this, and you're more likely to be irritable, angry, or sad. It increases the chance of career burnout as well. The pathological effects, so pretty much what diseases it can cause. It's shown to cause hypertension, depression, obesity, heart attack, or other cardiovascular diseases, and stroke. Um, while it's not the only cause, and a lot of these diseases are multifactorial, meaning a lot can be uh, factored into the development of this, sleep deprivation is definitely up there on the list of developing these diseases. So, how much sleep are we actually supposed to get? And really, the answer to this depends on the age. See, like as I have on the slide, it really depends on the age group that you're in. But for most young adults and adults, which is the majority of the healthcare working force, it's 7 to 9 hours. But a good question to ask is, how much sleep do healthcare workers actually get? And they've done many studies over this, and a lot of them, like more than half of them, report getting less than 6 hours of sleep per night, which is, an hour a night, uh, definitely adds up to be quite a bit of sleep deprivation and per week and per month and per year. Some possible solutions. So there are a couple of different solutions. So you can have new hospital regulations, whether or not, because it's pretty common for nursing shifts at least to be go from day or evening shifts or evening to night shifts directly to day shifts the next day. And hospital regulations, either changing or preventing that, can help out to decrease the amount of to decrease the likelihood of sleep deprivation in their workers. You can also make sure you sleep in your off time through like time management and everything and keeping a schedule in your personal life. But some limitations to these things is it takes forever to really get hospitals to change their policies. And also, in your personal life, things happen, you have family responsibilities, you have personal responsibilities, you have things that pop up that kind of cut into the amount of sleep that you can get every day or every night. So I just included these just because I'm pretty sleep deprived, so I thought they were pretty funny. Hopefully, you guys find them funny too. And these are my sources. Thank you for listening.